Direct Connection is made by MPT to serve all of our diverse communities and is made possible by the generous support of our members. Thank you. Live from Maryland Public Television, this is Direct Connection with Jeff Salkin.
Good evening. Welcome to your Direct Connection. Coming up tonight, how to talk about medical issues that many people do not want to talk about. Taboo topics. That's coming up. First tonight, the digital divide. President Biden announcing today deals with internet providers to offer better quality, lower cost access for people who qualify for a federal subsidy. We spoke with Jason Hardebeck, Director of Broadband and Digital Equity in the Baltimore City Mayor's office. Mr. Edwards, thank you for joining us. Tell us about this program and how it got started.
Sure. So Secretary Rona Kramer brought to the department the idea with the support of Governor Hogan after an economic development trip. And she thought, let's make durable medical equipment more available to Maryland residents. So what we really do, it's a first of its kind program where we collect donations of new or gently used durable medical equipment, home medical equipment, and mobility aids. We then sanitize and repair all items as needed, and then we provide them back to Maryland residents across the state. We serve Maryland residents with any illness, injury, or disability. And though we're the Department of Aging, we provide equipment to individuals regardless of their age, from children all the way through older adults, and we provide our service at no cost.
What have you found in starting up a program like this? How willing are people to donate, and how happy are people to receive these items?
Sure. Great question. It's really been a shock to us all. It's been a tremendous response from residents across the state. And as you said, the program is really twofold. There's two sides. There's the equipment distribution piece and then the donation collection piece. Now, from the start, we knew the idea of providing medical equipment to Maryland residents would be a great idea. We serve not only uninsured individuals, but also individuals who have insurance, who, the necessary equipment might not be covered, or those who have insurance but might be experiencing a delay in when they learn they need equipment to when they actually can get their hands on it, or those who maybe, for example, awaiting coverage or awaiting approval for a waiver program. Help those individuals. And we knew that providing this would, greatly improve quality of life and independence. Many times individuals just can't leave their homes, maybe can't even navigate their home, can't even make it to the bathroom or be able to use their own bathroom safely, getting out to the senior center, other community events. We knew it would help a great deal. What we didn't initially realize was the tremendous positive environmental impact. So essentially what we learned is that most of this equipment ended up in landfills, and we played a role in diverting it from landfills by reusing it and then providing it to Maryland residents. So what we really did is we set up sites at some landfills. We put empty containers there, and initially, before we even had the chance to market the program, they started filling up with medical equipment. So the response was tremendous, and to date, we've already collected over 10,000 items, which is equivalent to 350,000 pounds or 175,000 cubic feet. So to visualize this, 175,000 cubic feet, if you pictured a 3-bedroom home and you picture filling every room in those homes from floor to ceiling with medical equipment, and picture 8 to 9 of those homes, that's the amount of space we've saved from the landfills in the form of durable medical equipment. So the response has been tremendous from both the distribution side and the equipment collection side.
And each item is going to help somebody, maybe multiple somebodies. I saw that there's 2 categories. There's basic and complex durable medical equipment. Give us an idea of maybe some examples for each category.
Sure. So that basic durable medical equipment is the equipment you'd see if you walked into a local CVS or Walgreens or a local pharmacy. The simpler mobility items like canes, crutches, walkers, bathroom equipment like shower chairs, tub transfer benches, bedside commodes, or rollators. So this is the equipment that's a little bit simpler, a little bit easier to operate, and most individuals are familiar with them, versus the complex medical equipment. Complex meaning that it's either more complex to operate, requiring more training or oversight from a healthcare professional to ensure it's the appropriate size, or simply because it's a little bit bulkier and more difficult to transport and move around. But really, we just separate those for the ease of transportation, as well as ensuring an individual knows how to use or operate that equipment.
You have a central facility in Southern Maryland. What happens there?
Sure. So that facility is our headquarters. We call it our reuse center. So essentially what we do is we collect the donations of medical equipment from around the state, and then we transport it all back to our reuse center. That is a 56,000 square foot warehouse where the bulk of our operations take place. So we bring all donations back to our reuse center, where all items are first sanitized. So we have a thorough 3-step sanitation process. The final step being a full cycle in a machine called a hub scrub. A hub scrub is essentially a car wash specifically designed to clean durable medical equipment. It uses a wraparound high pressure spray system, and it uses both chemical and ultraviolet light to clean and disinfect equipment. And we developed all of our sanitation processes during the pandemic. So, when we didn't have a great understanding of COVID-19. So we took the highest level of sanitation we could, and even it kills the dirtiest bugs. So all items are first sanitized. They're then repaired. We have a technician specifically trained on how to inspect durable medical equipment for safety and general function. And then each item is repaired as needed. And even if an item can't be repaired, we'll break it down and cannibalize it. And then we'll take those parts to put it together with other parts to form fully functional devices. From there, all equipment is stored in our warehouse until it's eventually distributed to Maryland residents.
If somebody really anywhere in the state wants to learn more about this, maybe they have something they'd like to donate, maybe they're in need of something, how statewide is the operation at this point, and what's the best point of contact?
Sure. Best way to contact us and find out about the programs is to contact us directly. We have a direct phone number and email, as well as we have a webpage dedicated specifically to our program on the Maryland Department of Aging website. But to give you a little bit more information about how to access us throughout the state, as I mentioned, we have our reuse center where the hub of our operations take place. But our goal with this program was to make it accessible across the entire state. So what we did is create, like I said, the 5 landfill sites where individuals can drop off donations. We also created 8 additional satellite sites, which are extensions of our program at partner institutions where individuals can both donate equipment and pick up equipment for use.
And is there any charge for the service? And the other thing people are going to want to know, do you pick up?
Sure, great question. There's no charge for our service at all. All the equipment is free of charge. And we're happy to pick up equipment donations. If some of that equipment is a little bit too big and bulky and you can't transport it to one of our donation collection sites, give us a call or shoot us an email, and we'll set up a time to come make a direct curbside pickup.
Very good. Ian Edwards, Director of the Maryland Durable Medical Equipment Reuse Program. Ian, we appreciate your time. Thank you.
Thank you very much, Jeff.
And joining us now for our Your Health segment this week are Dr. Harry Johnson, a urogynecologist, specializes in female pelvic medicine and reconstructive surgery at the University of Maryland Medical Center, and Dr. Makora Malik, an OBGYN, also with the University of Maryland Medical Center. Thank you both so much for joining us. The idea of this segment is to talk about things that, frankly, people don't often want to talk about. And Dr. Johnson, I'll begin with you because one of the things you do is help women with urinary incontinence issues. You have great success with that, but it can't happen unless somebody comes in with the problem. Talk a little about the situation and how you can help people.
Well, thanks for having me. It's a pleasure to be here. Incontinence is a problem that's often hidden. A lot of women are raised that it's a natural part of aging, a natural part of life, and it really isn't. It's a problem that can be treated and treated very successfully, depending on why you have the incontinence. There's really two types primarily that we treat, which is urge incontinence, which means you can't get to the bathroom fast enough, or stress incontinence, which means you leak with a laugh, cough, or a sneeze, or exercise or activities. We have different treatments for each one. Both can initially be treated with pelvic floor physical therapy, but if that doesn't work, then for stress incontinence, we have some surgical options, which are pretty minimally invasive procedures that you can come in and be treated and go home the same day, really. And urge incontinence we'll often treat with medication first, but then we do use Botox and we use some electrical stimulation, which is a very good treatment that gives great success to people and really improves their quality of life.
The message is you don't need to keep this hidden, and you have ways to help.
Well, it is something that should be looked into if you have it, because there often are some simple remedies. The other thing can also be associated with pelvic organ prolapse, which people refer to as a dropped bladder, or something, something is falling down or coming out, and you can fix both of these problems at the same time often. So it is something that can really affect your life, but with proper treatment and diagnosis, you can really improve the quality of your life.
I don't want it to seem like we're blaming women for not coming forward when everybody knows that men would keep anything in the world secret rather than go to the doctor's office if they didn't have to. But Dr. Ballack, let me ask your thoughts on this and what issues you've seen in your practice where maybe you wish people had shared a concern a little bit sooner.
Yes, thank you so much for having me. I completely agree with everything you're saying. I feel that women oftentimes don't know how to enunciate their issues or even describe their problems, or even know that what they're feeling or experiencing are problems and issues that have treatments and resolutions. Oftentimes patients come in and, unless they are pointedly asked, may not discuss issues that relate to infertility, sexual function, menopause, and symptoms that they may be feeling with any of these conditions or more.
You both have faculty appointments at the medical school as well. Do you think there's enough training for doctors in the area of forming the relationship, asking the right questions to get the honest response?
Well, I think that this is something that we've really tried to educate medical students and residents in training to ask patients and not wait for them to bring up these subjects. And it's something that's been pushed for, I think, the last 5 or 10 years, at least, maybe longer, because everybody's aware that it is a problem that people tend to not ask about.
And people may turn to Dr. Google, and Dr. Google's answers sometimes are the clickbait and not the legitimate information that the patients need.
Absolutely.
Yeah.
I think a lot of times, again, women are just so embarrassed or concerned about their issues that they don't feel comfortable talking to their medical providers. And if they aren't asked point blank what the concern is, they may not feel that they can voice their issues. But we're very lucky here at the university. Not only have we been trained to discuss these issues with our patients, but I feel that we're very lucky that we get a lot of referrals for complicated patient diagnoses that we can discuss with the patients candidly. So somebody's been to the primary care provider and they need an expert, and you guys are the experts. I wonder if this has a little something to do with the way the primary care has changed over the years. You're less likely to have a family physician and to have formed that sort of personal relationship where maybe you're willing to confide something, and it's more likely to be very, very short visits with different providers all the time.
Well, I think one thing is a lot of the primary care providers now are using questionnaires that will try to identify these problems for them, so that you don't have to remember to always ask it. So it stimulates the conversation. But you're right, there is a shortage of primary care providers at this time. So it is something that you have to look at. And going back to Dr. Google, I think it's better for patients really to look at the websites at the hospitals. So the University of Maryland has an educational website on many different problems, and a referral system that directs people to the proper place for diagnosis and treatment of these issues. So, and there are a lot of issues for men and women. So this really applies to everybody, almost any problem you could think of.
Dr. Malik, in your experience, is there a concern like this, a medical issue like this, where the treatment has improved, medication has improved, maybe patients aren't aware and they think that there isn't help, or they think that there's a medical controversy? I'm thinking of, hormone replacement therapy.
Absolutely. I think menopause is a prime example of this particular issue. I feel like women may feel that there may be a stigma with treatment, or may have misinformation regarding the treatment options that are available. Hormone replacement therapy in of itself has a great stigma to it. Many people may think that hormones are not an appropriate treatment option, when in reality, we like to individualize treatment options for each individual patient based off of her symptoms and her needs. And there are a slew of non-hormonal options as well for patients that maybe patients don't know that's an option for them either.
I've got 30 seconds. And Dr. Johnson, to come back to you, if there's one thing that you want, I guess you're primarily dealing with older patients, one thing you want them to know, what would it be?
Well, that urinary incontinence is definitely treatable and can improve the quality of your life. And it's something that you shouldn't ignore. You should come in and be evaluated. Very
good. Dr. Johnson, Dr. Malik, great speaking with you. Really appreciate your time. Thanks so much.
Thanks for having us.
Now, earlier in the program, we began talking about the digital divide, and we spoke late today with Jason Hardebeck in the office of Brandon Scott, the mayor of Baltimore, where he is the director of broadband and digital equity. Jason, thanks for joining us. Let's start with the idea that good internet became more than a luxury during the pandemic.
Absolutely. So that's an excellent point, Jeff. The internet has been around for a couple decades, as most people understand it, but only in the last couple of years did I think we as a nation really understand and recognize how critical it is to just everyday life. Regardless of your needs, whether it's going to school, it's working remotely, it's keeping up socially, it's interacting in e-commerce, it's everything.
And people may think it's all about, Netflix, but especially if you're a young person, if you're a student, it's how you connect with the world and all the knowledge that's out there.
Absolutely. I mean, I think the days of having, that large collection of Encyclopedia Britannicas, that we all as kids at least aspired to, I don't think any kid nowadays even has an inkling of what that is, because all the knowledge of the world is literally at your fingertips.
So you're a veteran of the tech industry. You've been in this position at City Hall for about a year. When you look across the city of Baltimore, what do you see in terms of the need for connectivity? It's a little bit different than maybe some rural parts of the state where
Sure.
There's just no availability. There is no wire. There's no anything that's going to get you decent internet. Baltimore, that's not the problem?
Yeah, I mean, that's a big part of it, right? It's not just having physical access. The FCC considers Baltimore to be 100% served by internet service providers, which basically means that you can connect at least one house per census tract, right? So that doesn't tell the whole story. In Baltimore and other urban centers like us, affordability is a huge issue. And, it's not enough to just have access or be able to physically have access. You have to be able to afford it. There's a lot of other factors that go into that as well. So affordability is really too simplistic of a definition, but it's really about addressing, the reasons for that challenge for inaffordability in the first place.
So the deal that the president announced today with a bunch of internet service providers, including Comcast, which has Baltimore covered, I believe, is 100 megabits for $30 a month, which sounds like a really good deal, and for a lot of people, that's going to be free.
Yeah, I mean, and again, it's a wonderful news. It's amazing. Not to look a gift horse in the mouth, but one of my largest concerns is how long that benefit lasts. It is estimated that nearly 15 million households in the United States will be eligible for the Affordability Connectivity Program, which is $30 a month, to help subsidize or pay if the price of the plan is $30 a month or less, you get it for free. But if everybody was to take full advantage of that benefit, the funding will run out in less than a year. So there is currently not a plan to permanently fund a benefit like that. So it's a short-term program, and it's important, but I think we need to be thinking longer term as well. What do we do after the benefit?
And to qualify for the free internet, people need to be under a certain income level or have qualified for other programs. You're working on some direct things in Baltimore to just get Wi-Fi into people's neighborhoods.
Right. Yeah. So we see this as really it's complementary. In addition to the other benefits such as ACP and other digital equity initiatives and funding coming out of Washington, Mayor Scott and our entire administration is really focused on how we close the digital divide in Baltimore permanently, right? So we are thinking much broader and longer term about investing in digital infrastructure. And one of the things we will be doing is beginning to roll out public Wi-Fi, free public Wi-Fi in our most underserved neighborhoods. This is not intended to be a substitute for high quality internet at home, whether you're getting it through the ACP program through a private ISP or through another provider. But we will be doing that and starting in some of Baltimore's public housing developments this summer. And then we will also be building out and expanding on the city's existing infrastructure to bring fiber-based internet to public housing residents directly to their units as well.
I'm no expert on Wi-Fi, and I don't know if you are, but if you picture a standard city block in Baltimore with a line of row houses, and if there was a central Wi-Fi transmitter, could it cover 20 houses at once? Is that how it works?
Yes, but it's possible, but that's not what the intent. The public Wi-Fi program is really intended to serve community spaces, right? So these are parks, they are transit stops, public markets, community gathering spaces. That's really what we're focused on. They are not intended to serve residents inside their homes. Now, it's very possible that if you happen to live next to, let's say there's a light post with one of the city's Wi-Fi access points on it, you could probably get the Wi-Fi service in your home, but that is not the intent. And like most people, we all have Wi-Fi routers, or almost all of us have Wi-Fi routers in our home. So, we know that you could have great connection right next to the router, and you go to the other end of the house or a couple rooms over, and you've got a dead spot. So, again, the goal with public Wi-Fi is more of a convenience, and it provides folks with an alternative to paying for expensive data plans on their mobile devices if they can get onto the city's Wi-Fi service.
How does the city of Baltimore look at the rollout of 5G cell towers? Because it's very complicated, but you increasingly see them on utility poles and other structures, light posts. And if you're close to one of those, you can get all the broadband you need as well, right?
Theoretically. So I think it's actually a wonderful news that Baltimore is seeing 5G providers rolling out, right? And this is advanced infrastructure primarily for mobile, although some of the providers are all now marketing it as an alternative to fixed or wireline access at home. You can get a 5G, essentially a hotspot that's designed to serve your stationary needs in the home as well. And I mean, that is a in theory, a great service, but there are some limitations. I mean, 5G doesn't mean that it's completely wireless. 5G requires fiber optic connections at those towers. You know, the goal is not to make it wireless all the way back to the internet, if you will. It's really that last mile or so connection. And really, in the case of 5G, the higher the speeds and the higher the bandwidth, the shorter the distances are. It's just simple physics. And that's why there's so many of these towers and sites throughout. So there is there will become a point where you can't put any more towers in place. And the other aspect of this is affordability, right? I mean, this is a premium service. So that is another concern, right? Is 5G really a solution for everyone, or is it just for those folks who can afford that service?
The pace of change not slowing down at all. Jason Hardebeck, Director of Broadband and Digital Equity for the Baltimore Mayor's Office. Jason, thank you very much.
My pleasure. Thanks.
And that is Direct Connection for this week. Join us every week at this time for your chance to ask the experts. Please follow us on Twitter at MPT News. Now, for all of us at MPT, thank you for watching and have a good night.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.
This program was made by MPT to serve all of our diverse communities.